All right. Let me get organized here. Hang on. There we go. All right. I just opened Zoom and again it updated and my meetings are gone. So another one of those days. I'm feeling a little flustered trying to figure out Zoom again. I don't know why they keep changing things. Hi, Sheena. And Tina's here too. That's awesome. So today I want to talk about NPA or negative palmar plantar angles. I feel like this has been my theme for not even the last 2 months, but like the last 6 months of my life. It has been something I have not been able to get out of my head and ignore because it's directly impacting so many things. I've been dealing with it on my own riding horse, and I mean, I've been dealing with it for a while with her, or suspected, but I didn't know for sure until I got x-rays in March. And it was very, very minor, but either way, I noticed a big difference in correcting it and how she moved and functioned biomechanically. So definitely something that's been on my mind. And one of the things that I see past students, it was, I don't know what to call it, maybe not, I didn't put enough emphasis on looking at that angle of the coffin bone in the hind feet in my teaching courses. And I found a lot of students would just trim those hind heels to 1 1/8 without really thinking about the angle of the coffin bone, which is something we think about in front feet, just on much less significant of a degree because typically in front feet it's a little bit harder for horses to have that negative angle, not impossible. And just while I'm thinking about it, the NPA, negative palmar plantar, palmar meaning front feet, plantar meaning hind feet, I think that's just too much to say, so I just call it NPA. And I don't really care if it's front feet or hind feet. Doesn't really matter. It has the same implications, except that NPA on hind feet tends to be a little bit more significant in terms of the horse's body. Because the negative angle on the hind foot can stretch the tendons and ligaments down the back of the leg, it can cause the hocks and stifles to overextend, and it can rotate the pelvis just a little bit, which can result in lower lumbar discomfort or strain as well. So that's a lot more of a physical concern versus an NPA on the front foot. Because that front limb is attached only via the scapula with muscle and tendon, it's a little bit less significant in terms of what it does to the body because it only changes the connection point of the leg, which is mildly better, but still not the greatest thing. So we definitely need to work on correcting it, whether it's front or back. In the slideshow that I made, I was putting it together last night. I think I did, I can't remember if it was 3 or 4 examples. Most are hind feet, but one is a front foot. And I did do a healthy front foot just as a comparison. So we're going to go through those. If at any time during the slideshow you guys have a question who are on the Zoom here, just please unmute and interrupt me. I can't always see the raised hands or the chat when I'm in a slideshow. Again, obviously my knowledge of Zoom is lacking because I don't know how to do all those things, but please feel free to just ask away. And
I'm going to I'm going to interrupt you.
perfect. No, that's
You
good.
say, okay, are you going to go into the people that like I assume that I misunderstood too, the hind legs or the heel and the coffin bone? Are you going to get into that one? Because I assume the coffin bone is it correlates to the collateral groove.
Yes, the bottom of the coffin bone relates to the bottom of the collateral groove because directly underneath that groove is sitting the bottom of the coffin bone. So if we can read the plane of the collateral groove, we can determine the angle of the bottom of the coffin bone without an x-ray.
Okay, the plane of the collateral groove, meaning if you
Like,
go into that one during the presentation, it's okay.
no, I didn't really. So, we should talk a little bit about what creates negative angles. I'm going to go, the presentation is going to show a bunch of different feet with the coffin bone, with the radiograph and the coffin bone superimposed on the picture to show both, okay, with the radiograph, that's awesome. If every horse came with that, it'd be so obvious and we would know. But most horses that I work on don't, so I have to know how to read it. But What's important is reading the bottom of the coffin bone placement from the bottom of those collateral grooves. So the deepest, like darkest, dirtiest part of the bottom of that collateral groove, we call the dirt line. And it is simply where in the back of the foot, the bar wall comes down and meets the frog. And in the front of the hoof, the sole comes over and meets the frog. And we call it the dirt line because it really, that's what it looks like. As you're trimming, like not that we ever would take our knife and carve out the bottom of that groove because we would be thinning the sole and the union of those things if we did that. So we wouldn't want to. But on a cadaver hoof where we can, just to explore, as you start carving that out, you will see the sole right next to the frog, and there will be a little line of dirt pressed in between where they join, and same in the back of the foot, but it's really hard to see in the back because the collateral groove is deeper back there. The other thing we should probably talk about before we get into the slideshow, and I know you guys have probably heard me say this to death, but I'm going to say it again. When we talk about a ground parallel coffin bone, we are talking about a ground parallel coffin bone at peak impact of the stride. That means when all the weight is coming down on one particular leg, like whatever, the other three legs are in the air and that leg is on the ground, and everything is expanded both medial-laterally and up and down to compress that concave shape in the bottom of the hoof, that is peak impact of the stride. And so when that hoof is fully loaded at that moment, that's when the coffin bone should have descended down to be ground parallel. And then as the horse moves, everything's going to contract and lift back up, and that coffin bone will no longer be ground parallel. It should be sitting somewhere between 3 to 5 degrees in a positive angle. What happens is we can't measure a horse's collateral groove at peak impact of the stride. We can't even x-ray them like that because they of course have to be standing on all 4 feet for us to do that. So we have to leave room for that interpretation or understanding of those 3 to 5 degrees. So when I look at an x-ray, if I see just a tiny bit of positivity to the coffin bone, and I know that's not a scientific term, tiny bit, but if I see just a little bit of elevation in the back of the coffin bone, I'm happy knowing that I have likely that 3 to 5 degrees, versus if there's a pretty significant tilt to the bottom of that coffin bone, then we're looking at more. And we could, a lot of vet, all of their radiograph software can mark angles and lines, and so that's super helpful when they do that for us. If we don't have that, we can use the that HoofM app or Hoof Map app. It's a mouthful. That app, you can measure your angles, things like that. I gotta be totally honest. I'm not hung up on like 1 to 2 degrees of angles. As long as we are somewhat in the ballpark, I'm fairly happy. So I don't actually need to know the exact degree. I think there's averages in this, and like even 3 to 5 degrees is probably not totally accurate. It's probably more like 3 to 10 degrees based on the individual conformation of the horse and what's going on higher up in their body. So I don't get super hung up on that, but it is, just important to talk about so that you're not thinking that, a picture of a healthy foot with the coffin bone inside at rest, that coffin bone bottom surface should not be ground parallel. It should be slightly elevated. And you'll see that as we get into it. The other thing I just want to touch on that is not in the slideshow is why we very commonly end up with NPA. And typically on the hind feet, it's very rare to have NPA on front feet. If we do, it is almost always in foundered horses with distal descent that are missing a fair bit of the coffin bone. Just the way the horse moves, the front feet don't tend to be as affected. If they are, they're always the super long forward toe under run heel type of idea. In the hind feet, it's not always because of that. We have to remember that the hind feet or the hind limb, sorry, is totally different than the front foot or front limb. It's like the limb was put on backwards. When we think about how the hawk bends the leg, it bends it the complete opposite direction. And that's because the front end and the hind end of the horse do two very different things. The front end is like a couple of pillars that holds the mass up, and the hind end is meant for sitting under and driving and pushing forward. So they do completely opposite things, so it makes sense they're backwards, but we have to think about them in movement in the stride, how they function. A front leg or a front hoof really is like a helicopter. It can land and take off straight up and down. It does not need forward propulsion to do that. I mean, obviously horses have propulsion forward, but the front limb doesn't really need that. It just kind of can go up and down. The hind leg absolutely cannot articulate like that. It has to come in for landing like an airplane and take off like an airplane. It does not just lift up and down unless of course a horse is standing there kicking at a fly or something like that. But in motion, it has to make those sweeping arcs. And it's during that arc, as that hoof comes in to the stride, still lands heel first. Although I will say hind hooves tend to not be as dramatically heel first as the front limb because they do not have as much elevation in their stride. So they come in, they land heel first and come down on that slide in, if you think of an airplane coming down, how the wheels sometimes just like touch and bounce a little bit, the heels do the same thing. And it's very, very common for horses to wear their hind heels more because of how that leg articulates. And so I will say, as an average, for 85% of the horses I trim, I rarely trim the heels on the hind feet. Rarely. Every now and again, I will come across a horse that the way they move, they have more elevation in their hind end and they don't wear those heels as much. Excuse me. And they will be growing in more vertically. And I will actually have to trim heel on a hind foot. But it's rare and it's not the norm. So where I think I failed in my early teachings of my trimming course is, we relied too heavily on the hoof mapping, talking about the average height of heels should be inch and an eighth. And everybody just kind of got that in their head and they'd pick up a hind foot and they'd mark inch and an eighth and they'd trim without looking at some of those external factors like the angle of the dorsal wall, which we're going to talk about in a second, and if it's a little bit bull-nosed, or the bottom of that collateral groove, and what are your depth readings. So when we read the depth of the bottom of the collateral groove, in the back of the foot, in the very deepest part of that bottom of that collateral groove, let's just say we have 3/4 of an inch of depth. And then you read the front of the hoof at the apex of the frog. And when I'm talking depth there, I'm not really talking about depth of the groove because there is no groove there. I'm talking about depth of the solar concavity. So if you held a rasp flat across the concavity of the hoof at the apex of the frog, how much distance would there be from the apex of the frog to the bottom of the rasp or the ground plane of the hoof? Let's just say in the back of the foot we have 3/4 of an inch, and in the front of the foot we have 1/4 of an inch. That tells me we have a positive angle to the bottom of the coffin bone. Again, I don't really care how many degrees it is. I want to know if it's minor, medium, or like extreme, huge difference. That's kind of where I think about it. But let's just say we have 1/2 an inch in the back and 1/2 an inch in the front. That tells me the bottom of that coffin bone is ground parallel right now at rest, which means at peak impact, it's going to sink to be negative. Did somebody have a question? I thought I heard somebody cut in there.
I was coughing, but I do have a question.
Oh, okay.
Not a question, but so is that why so basically the tip of the coffin bone should be rather low, like pointing down.
Yes.
So is that why we try to avoid, or why we work on avoiding a horse going toe heel first? Because if they go toe first, there must be pressure on that coffin bone too.
Yes, if we think of the anatomy of a hoof, there is nothing in the front of the hoof that can absorb impact energy. You've got the tip of the coffin bone, the hoof, the dorsal hoof wall, and the sole. None of those structures can absorb impact. Whereas in the back of the hoof, we have the frog, digital cushion, and lateral cartilage. All of those, that's what they're designed for, is to absorb impact. So to me, anybody who questions whether or not horses should land heel first, I'm like, that's really obvious if we just look at the anatomy and how it's designed.
Okay. And I have to figure out how to, like, I'm just started to realize that I always went for the heels first and then the toes, and probably not as much as I should because of the white line, cream line, and all that. Um, but now with you talking about this, and I realize that I have really no idea how to put the collateral groove depth at the end of the end of the hoof in correlation to the heel heights or yeah. So I need to figure that one somehow out. And I have cleaned out the collateral groove with my hoof knife because I want to get all that crap out. So I wonder if I actually thinned the collateral groove.
No, not likely. I mean, obviously you could have, but it would be pretty obvious, and it's really hard to thin with a hoof knife. Like you have to be trying to thin it. I'm just gonna grab a hoof and try to elaborate on that.
Okay. Sorry if I bore everybody else, but if I don't know something, maybe somebody else doesn't know it. So,
No, that's perfect. I'm happy to explain. That's the point. Okay, so this is a wild hoof, super healthy, nice. I would call it that anyway. So I just want to show you what I'm talking about when I'm saying measuring the depth of these collateral grooves. So if I think about, hang on, I got to see where's my camera here. If I think about this collateral groove here, and this isn't the best ruler because it's too big and it doesn't measure right, but you'll get the idea. And I measured the depth at the back of this foot at the deepest part of the collateral groove. And I almost need a third hand and another ruler. But what I'm measuring to is the ground surface, which is where this ruler sits right here, right now. And I can't obviously have two rulers and three hands. So if I measure the depth in the back of this foot to here, I would say it's pretty close to an inch deep from the surface of this ruler to the deepest part of the bottom of this groove. And this ruler actually sucks. I need something more pokey and thin, like a pencil. So this pencil sticks all the way down in there that far, which to me is it's pretty deep. It's probably even more like an inch. Now, let's do the same thing at the apex of the frog. This I can probably do with two hands. The depth at the apex of this frog here to the bottom of the sole there is that far. Okay, so I know this is really not super scientific, but if we have the back of the foot this deep and the front of the foot this deep, I know we have positive angle to the bottom of that coffin bone. Because to me, it's sitting like that. Hang on, like it's sitting like this. So I know the back is higher than the front. Now let's look at a foundered hoof where that's probably not going to be the case. So back of the foot, depth to the deepest part of this collateral groove. Okay, I'm right here. There's like a 1/4 inch of yellow sticking out from my finger. And then let's go to the front of the foot at the apex of the frog. The depth here is like there. You can't hardly even see it. This horse has very thin soles. So what did I say? 1/4 of an inch of yellow versus here. So we have a much more extreme angle on this hoof, right? If we think about, can't even get this down that far, the angle of that coffin bone in this, which makes sense. It's a foundered hoof and the coffin bone is rotated at an extreme angle. So to me, that would make sense. You can also, just for fun, see how thin this sole is. That's why we have no depth, because this coffin bone was just about to poke through the sole on this hoof. I don't know if I have a negative angled one. Mm, not
but
that I,
wouldn't the depth of the collateral groove, if I over trim the heels and if I over trim the frog, that would make a difference with my measurement.
yes, because let's just say we're going to cover this too. But let's
Okay.
just say right now, your horse's coffin bone is sitting like this. It has elevation in the back, less elevation here. We have positive angles. Everybody's happy. And then you come in and you trim the heels and frog, and you don't trim the toe. All you've done now is change the elevation of this coffin bone. And of course, I'm being extreme here, saying you way over trimmed the heels and you brought it down so that it's ground parallel at rest. If you then went back and trimmed the toe, you could restore a little bit of angle. So we really have to think about this when we're trimming. If a horse comes in and has a perfect angle to their coffin bone, and we take a 1/4 inch off the heel and a 1/4 inch off the vertical height of the toe, we will maintain that same angle. But if a horse comes in with a perfect angle and we only trim heel and not toe, we will decrease the angle of that coffin bone. And the other thing, if they come in totally normal and we don't touch the heel and we only trim the toe, then we will make the coffin bone even steeper. So we cannot change the lamellar connection from the hoof wall to the coffin bone in one trim. It is going to stay wherever it is, and we have to grow in a new one. But we can change the angle of the hoof and the angle of that bottom of the coffin bone in relation to the ground with our trimming. So that's the reason we don't have to wedge every negative angle we see, because we can sometimes improve the angle of the coffin bone with trimming. Other times we can't improve it enough, and I'll have to go to a wedge, which I've got both options or both examples in the slideshow. Are you kind of following that, Tina?
Yes, that one I comprehended. I understand that one. Have I put it in practice? Definitely not.
It's
So
okay.
hopefully I didn't make my horse wrong, bad. She's a little off with her walking, but um, okay. I think I got it now.
Awesome. And if anything else comes up, let me know. That's the whole point here.
Yeah.
I'm going to launch into our slideshow, and we'll go from there. Alrighty. Okay, so I just include this because I want you to be on the same page as me. We are talking about the coffin bone placement in relation to the ground surface. I didn't put a line on here on the ground surface, but we'll get there. I did on all the pictures. Also, I know, Tina, I had posted this. I don't remember when I updated this graphic. Obviously, sometime between the one you posted and now, because I didn't just do it now. I must have done it a couple years ago, but the old graphic showed this pink line coming all the way down. The white line, that's not white, that's golden, is built and formed by the terminal pupilles, and the terminal pupilles live around the rim edge of the coffin bone. So the white line does not go all the way up underneath the hoof wall. It only starts at the rim edge of the coffin bone. And the whole point of the white line is to glue the sole right here to the hoof wall, because up here, the pink is, we have sensitive and insensitive lamina. And the inner unpigmented hoof wall, or the water line, the line that on the bottom of the foot is bright, bright white. Most traditional farriers would call it a water line. Most barefoot trimmers call it inner unpigmented hoof wall, but it's the same damn thing. That is also your insensitive lamina on the backside of the hoof wall. They're all the same thing. It's all the same structure. It just has multiple names. And it's the only bright white that you see on the bottom of the ground. It would be in between this white golden line and this brown. I should actually put a very bright white line in there to actually be more accurate, because it would live right along here. And so that insensitive lamina is interdigitated to this sensitive, full of blood and nerves lamina around the coffin bone. And as this hoof wall grows down, the insensitive lamina grows all the way down with it. And when it gets to here, there's no more sensitive lamina for it to connect to, and it can't just connect to the sole. The sole does not interdigitate with the lamina like that. It's a totally different structure and can't do that. So the terminal pupilles secrete the golden line, which seals the sole to the backside of the insensitive lamina. And that's when everything's healthy. If we have excess flare or mechanical founder and too much leverage, and we start to have stretching of the white line, it can stretch before we have rotation and founder. And so the terminal pupilles just secrete more, I call it liquid keratin. It's kind of like a silicone to fill that void. And then at some point, if the lamina lose their connection and we end up with rotation, it doesn't happen like from 0 to 100 in one day. But if over time it's stretching, 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 as it stretches, the terminal pupilles quickly fill that void, because there can't just be an empty space there. And so when we talk about horses having lamellar wedge, again, this is so confusing, because the term lamellar wedge really just means stretched white line. They're the exact same thing. I remember my aha, eye-opening moment. It took me, maybe I'm a slow learner, but it probably took me 6 years to realize that lamellar wedge was simply just the white line, massive and huge and acting like a wedge. because as it separates, something has to fill that void. And the only thing the hoof can throw down in there is that same material of the golden line. Now, that material is secreted from the terminal papillae around the rim edge, the bottom of the coffin bone. So how does it get way up here? It's like a liquid silicone, and the hoof presses it into there, kind of like spray foam, if I could think of it like that. Obviously, I'm a cheap farmer who does all my own home repairs, but it's like spray foam that goes up there and fills all the voids because there can't just be a gap. So hopefully that kind of clears that up, Tina. I know it's confusing, and it's even harder with everybody having different names for everything.
Yep. Yeah, I understood the white line, the golden line. What I couldn't figure out, how does the white line connect to the golden line, the lamina? So in this picture, it shows the lamina, which is, in theory, yeah, you're missing one of the lines, like the outer pigmented and the inner unpigmented.
Yeah, so theoretically, the lighter brown was supposed to be the unpigmented, um,
Right.
but it should have been white, not brown.
Right. So let's assume there's a white line.
Yeah, that would be
So
coming
it's
all the way down.
right in front of the lamina. So I theoretically should not see any lamina on the bottom of the foot, or at the water line shouldn't.
Yes, you
Because
will.
sometimes when okay, so the
You
white
will
line,
see the lamina. The super bright white is the lamina. That's the inner unpigmented hoof wall, which is this insensitive lamina. They are the same thing.
all right, I'm not. I thought I had this straight.
That's okay. Okay, so look at this. Hang on, let me exit this. So if we look at this hoof right here, this is a
Yeah,
much better example because it's accurate. So we have the super dark along the outside. That's our outer pigmented hoof wall. The
correct,
super bright white, this is our inner unpigmented hoof wall, which is also the insensitive lamina. And it
correct.
runs all the way down to the ground on the inside of the hoof wall.
Okay, got that.
And at the tip of the coffin bone here, hang on, I
Yeah,
can't see it backwards like that. It starts right in this little black dot. This
yeah,
is our white line coming down, which is sealing the sole here to the inside of the hoof wall. And so
okay,
the white line seals this insensitive lamina to the sole. That's its whole
correct.
purpose. So
Got that.
from the bottom of the foot, when we are trimming, that where is it? This white or light or whatever you want to call it, that is the insensitive lamina.
Correct. But how do I get, if you turn it to the side, where is the golden line from the side?
Here,
Yeah,
right at the tip of my fingernail. It's growing from the bottom of the coffin bone forward. Maybe
right.
it's
And how does that connect to the lamina? I thought that, am I not getting something? Should I just stop and I'm going to
no,
listen to the
no,
recording
it's okay.
again.
I'll give you a few more minutes, Tina. Don't panic. Um, so it's hard to see on this foot. Let's look at a foundered foot because it's way more obvious, okay? So So here's the inner unpigmented hoof wall or insensitive lamina. And ignore that there's a big jagged groove in it. That's because we were healing this horse's founder before she passed away. So she was 3 months into rehab, growing connected hoof wall, and then she colicked and died. But so we have inner unpigmented hoof wall or insensitive lamina. And up here on the coffin bone, it's connected directly to, or would be connected directly to, sensitive lamina full of blood supply. But because this one is detached, the white line has filled this whole void like spray foam I was just talking about. So all of this beigey opaque coloring here, that is all white line.
Okay.
And so it attaches to the insensitive hoof wall. Think about it like we have the leafy, insensitive lamina on the backside of the wall, and it literally feels like leaflets. Let me grab a foot. I don't know which one will be easier to see. white or black. But so on the inside here, can you hear that? Like
Yeah.
it's
Yeah. Yeah.
little leaflets. That is the insensitive lamina that we are staring at on the inside of this wall right here. And so it's like little pokey leaflets sticking out that interdigitates with sensitive lamina, and then it lets go, grows down, reconnects, let go, grows down. And because the sensitive lamina with blood supply doesn't move, it stays around the coffin bone. And so they have to be able to let go. It has a really long, fancy name. I can't remember what it is right now, that entire process. But I think about it like the lamina all doing the wave. They don't all let go at the same time or the hoof would fall off, but on a microscopic level, they're letting go and moving down. And so that insensitive lamina moves all the way down. And when it gets to the bottom edge of the coffin bone, it's got all these little leaflets. And so those terminal papillae inject that spray foam, if you will, to fill those leaflets. And that's what creates your white line. So there is no interdigitation of lamina in the white line. The back of the insensitive lamina aren't really connected to anything. It's like the terminal papillae inject that spray foam to create that airtight seal. Is that a little helpful, or are you even more lost?
No, I think it's a fast talking. My brain is a little slower. And if I look at the picture and follow what you say, it might be easier. So I'm going to listen to the recording. I thought I got it, and I think I did get it. I do get it. It's just the connection or the how is the golden line at the bottom of the foot that's connected to the outer wall and the sole. How is that? Where does that connect, or how is it does it connect to the lamina? But you just said there's like the spray foam from underneath the coffin bone, like for lack of better.
Yeah, if spray foam's not a right word, think about it's like glue. It is literally like liquid glue that comes out of, let me go back to my slideshow here. It's like glue that shoots out the tip of the coffin bone here to fill this void
I
because
can't see your cursor. I'm sorry. Go ahead. Do it again. I can't see your cursor.
oh, can you
Oh,
see
there it
it?
is. Okay. Yep.
So it's like glue at the bottom of the coffin bone that gets injected between the two. So it's not really connected to the lamina, except that it's liquid and like glue, so it glues these two things together.
Okay. Okay. So that does make sense. So it's not like okay.
It's not like an
'Cause
interdigitated lamina at all, not the golden line.
all right. So I if I cut the toe and I start seeing blood or pink lamina, I know I'm close to the coffin bone or at the coffin bone, probably.
That would be incorrect. Now, here's the thing. If you cut all the way through the hoof, way the heck up to here, absolutely, it would gush blood and you would be close. But what happens is, if we think about the foundered hoof, as this wall tears away and rips apart that interdigitation of the lamina, it bleeds up in here. And that insensitive lamina still grows down the hoof, full of bruising and bleeding. And then it gets down here and the glue, that is the golden line, is injected, but there's still bruising and blood in the insensitive lamina, and that can create the appearance of bruising in your golden line. So but then that can grow all the way down to the ground level. So if you pick up a foot and rasp just a bit off the toe and you see bright red in that um, golden line, it could be that you've trimmed way too much off and you're too close, but it's very unlikely. It's more likely that there was bruising way higher up that is growing out the hoof capsule. Um, Very rarely on any part of the hoof do you see pink or red before it starts gushing blood. Um, Even if you had a healthy white line that was not bruised and you cut it way too short, it would be golden, 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 gushing blood. You would not get a pink layer right before it bleeds. The hoof doesn't really work that way because the blood supply stays in the blood, like in the blood vessels, and then you have hard keratinized tubules that do not have blood in them. So you go from white to bleeding the blood doesn't wick down through the tubules to start bleeding when they get thin.
Okay.
So don't see bruising in the white line and think, "Oh my gosh, I'm way too short." It's probably not that. It would be very, very rare for it to be that, and you'd have to be so short your horse would be dead lame and wouldn't even be able to stand still.
And yeah, I was worried about cutting too short, but I'm just thinking of, if anybody worries about cutting the toe too short, it you would have to go into the sole too.
Oh, yes, you have to go very, very short to be
Yeah.
too short. Yes.
But I think explaining where the white line actually is, or golden line is actually coming from, that makes more sense because it just stops, the lamina stops, and the sole corium stops, and then suddenly it's a white line. So I could never figure out how it actually, I know that the sole's producing it, but how does a white line and the lamina and the sole corium connect?
Mhm.
But it's more of a glue, not lamina. It
Yes.
doesn't have it doesn't interdigitate.
So
Okay.
you will see online people who talk about the white line coming all the way down the inside of the hoof capsule. That is incorrect, but it's out there, which is where things become so freaking confusing. It just doesn't
But
work like that.
they talk about the white line as the white line or the white line as the golden line.
No, they think the golden line comes all the way down. They're wrong. It does not. But some people think that. They have clearly not done enough dissections, or any, because the
Okay.
golden line does not come down the whole inside of the hoof wall.
Okay. I really appreciate you going into this one.
No,
Um,
no
because
problem.
I thought I was totally clear on it, and then I start thinking like, wait a minute, how does that connect? Okay. And I cannot see your cursor. It's little and it's white, and I've had
I
problems before. Can that be like a big hand or something?
have no idea.
Maybe other people have eye vision, yeah, vision issues too. Okay, I'll shut up for today and I'll let you go ahead with your plan. Thanks, guys, for being patient.
Okay, no problem. I'm making a note. Surely, I mean, I got all these little buttons here, but if I start pushing them, I'm going to screw up my slideshow. So I will see if I can make the cursor bigger. Probably I can. I just don't actually know how to do it. So I will look on that for another day because I don't want to screw up this slideshow.
Yeah, not now. Just
Okay. Okay, let's get into NPA. This is not a negative hoof. This is a healthy front hoof from my horse Tango, but I wanted to start here so we can understand what I'm talking about as we start working through what the more negative feet. And so when I look at this hoof, I mean, it's not perfect. I can pick any hoof apart. I've got jammed cartilage and a rounded heel and all these things. I don't really care about that. What I want to look at is the corresponding x-ray and the placement of the coffin bone within the hoof capsule, and specifically the bottom edge of this coffin bone to the bottom surface of the ground. And so I got really creative. This is why it took me so many hours to make this slideshow last night. And I actually cut out the coffin bone so that I could place it imposed on the top of the hoof. And I'm not a graphic designer, so this was actually really challenging for me. So I hope you all can appreciate that. That's why it's not perfect. But so when I look at the outside of the hoof capsule, I would envision the coffin bone something like this on this particular hoof. We have a parallel connection between the dorsal surface of the coffin bone and the dorsal surface of the hoof wall. If I could pick this hoof up and hold it in my hand for you right now, I would see a greater depth at the back of the collateral groove than we have at the apex of the frog in terms of the depth of concavity, because we have a positive angle to this coffin bone. And so if we go one slide forward, the yellow line is showing the bottom angle of the coffin bone and the blue line is showing the ground surface. You can see that there is a greater distance in the back, so we have a positive angle. I would say this is somewhere between 4 and 5 degrees of positive angle. My vet did not mark it on my x-ray, so I can't tell you exactly, but I would be happy with this angle. To me, if I looked at this from the bottom, I can tell you from experience, this would equate to about a 1/4 inch of difference from the back of the foot to the front of the foot in terms of the depth of those collateral grooves. This would be like 3/4 inch at the back, 1/2 inch at the front. It's about a 1/4 inch difference that gives us that 3 to 5 degrees. All right, so now um, we're just comparing the two here, I think, just so you can see them side by side on the X-ray and from the picture. Um, I would be pretty happy with that. Now I want to look at this hind foot. This is Tango's right hind. And so when I look at this hoof wall, the first thing I see to me in my eye is kind of this bull-nosed angle, how it kind of comes halfway down and then drops off. That is usually indicative of a negative angle. It's because the bottom of the coffin bone, the tip of the coffin bone is pressing upward and it actually folds the hoof wall just a little bit. It's not extreme, but just a little bit. And if we look at this coffin bone on the radiograph, you can see that right now, just standing here, it's ground parallel, which means at peak impact, it's going to be sinking down negative. So here it is imposed on there, um, ground parallel at rest. If not a little bit negative, actually. When you put the lines on it, it looks a little more negative because it looks like there's a greater distance on this side than there is on this side. So the tip is actually raised up. And so if we look at that here, same thing. We can see that there's just a slighter larger distance here. So I think about this in terms of the biomechanics of the horse. You know, as all the weight comes down and that coffin bone sinks down in the back of the foot, it's kind of like if you stand on the edge of a deck or on a stair with your toes on the stair, but your heel sinking down. It's a really good calf stretch. Well, I think of that for the horse. That's what a negative angle creates, is it overstretches the whole back of the leg, which can cause the hocks to have to open more. It can cause rotation of the pelvis, which can cause bracing in the lower back. So it's not as simple as, oh, it's just a good calf stretch. I mean, horses don't have calf muscles, but it's not, you know, the same thing. It's not just a good stretch. It can actually cause damage to all of those structures and overextension. And then it causes dysfunction in the body. So it's definitely something I want to think about fixing or improving. So this is just a difference in her front feet to her hind foot. And when I look at these, it's really hard for me to articulate and explain to you how I can just look at this hind foot and know that it has a negative angle. Um, to me, it's a few subtle things. The angle of the coronary band. So if we look at the front foot on the left side, that angle of the coronary band is sitting at about 30 degrees. The angle of the coronary band on the hind foot is steeper than that. The average angle of the coronary band, and when I say coronary band, I'm not talking about the arched coronary band. I'm measuring this red line from the coronary band at the back and at the front, and I'm ignoring the arch. The arch is a reflection of not is of jammed cartilage because there's not enough quarter relief here. It had grown out. And so that's an important thing. It's just not really related to this. So I'm measuring from where it's connected at the front and the back. And this one is a lot steeper. The other thing I'm looking at is the dorsal angle versus the heel angle. These two angles should be parallel to each other. So that the hoof is evenly loaded. But if you look at any underrun heel or this hind foot, for instance, this heel angle is getting sucked under the hoof more than the dorsal angle is. And then we also have the bull nose. So for me, when I look at this hoof, I just instantly see the negative angle because every time I look at a hoof, this is what I see. I see the coffin bone inside the hoof capsule. And I see it by like when I've already just cleaned this foot out and I've cleaned out the collateral grooves with my hoof pick, I have already visually measured the depth at the back compared to the depth at the front as I'm cleaning the foot out. It's not something like I don't take a ruler and actually measure it. I can eyeball the difference between a half an inch and a quarter inch or 3/4 inch and a quarter inch or something like that. So I've already eyeballed it as I'm cleaning the foot out, and then I put the foot on the ground and stand back, and I go, oh, the heel's sucked under, the wall's flared, you know, maybe flared forward, or it's bull-nosed, something like that. And I literally envision coffin bones in the side of hooves every time I look at them. Every picture I look at, I am placing these, and I'm doing it based on things like the coronary band location and the extensor process of the coffin bone, those are linked by a 5 millimeter difference. I am also looking at, the connected hoof wall as it comes in on that upper half an inch. In this horse's case, it's connected all the way down, but I'm looking at that upper half an inch to give me an idea of the front of the coffin bone. And I've dissected enough feet to just understand the shape of the coffin bone, which, by the way, this is not the coffin bone, it's the navicular bone. But it was really hard for me to cut this out. And by the time I realized I had included the navicular bone, I wasn't going to redo it. So that's why there's a navicular bone floating here, but we're just going to ignore that. Or you can just include it so that you know where the navicular bone is. But I'm always picturing the coffin bone when I look at these pictures. And that's where, like, I know so many farriers or veterinarians or trimmers who are like, how can you possibly know, like, how could you diagnose a founder without an x-ray? Well, because you have to know where the coffin bone is. I can't diagnose anything because I'm not a vet, but vets should be able to diagnose this by looking at the hoof. Radiographs are awesome. I'm not discounting them, but they're just not always reasonable. And this is where we really have to develop that x-ray vision to know what we're looking at so that we can make an informed trim plan. So, so important. Okay, let's look at Aspen. What I want to show here is the difference from potentially what I would see on the left in the before trim photo as a negative angle. Now, this hoof from a negative angle perspective doesn't really seem to have a big bull nose. There's a little bit of one. You can see the angles start to change right about here. But I do see the underrun heel, the long forward toe. The hairline's not too bad. It's a little steeper than it needs to be, but it's not terrible. And then we have an after trim. We're going to pick that apart in a second. But let's just put our coffin bones on, and for a quick minute, I see an extreme negative angle on the left, and I see a positive angle on the right. And this is what I'm talking about when I talk about if we don't trim the heel and only remove vertical height off the toe, we can change that angle with a trim, which is the coolest thing, that we can reduce the strain on those tendons and ligaments and actually realign the coffin bone. And now, again, I'm just going to stress, we did not change the connection, like the lamellar attachment of the coffin bone to the hoof wall. It stayed exactly the same. Because the coffin bone is part of a rotating joint, all we've done is change the rotation that it sits at when the horse is standing there. So we have been able to realign it simply with a trim. That is awesome when it works that way. And that would again be by removing vertical height off the toe and not the heel. And so just looking at this foot, I look at it right away and big glaring things in my head go, oh my gosh, negative angle. Oh, sorry, Tina, I just saw you put something in the chat. When was that? 6 minutes ago. It's probably irrelevant now. Our
So
hoof
just,
and
yeah, just ignore it. You explained it already in the second picture. Go ahead.
good.
Just
Okay,
ignore it.
sorry. See, that's what I
Oh,
mean. I get so caught up in the slideshow, I forget to check things like the chat. It's
don't
better
worry.
just to interrupt me because otherwise I might not notice.
Okay.
Um, so I look at this foot and I see this, flared angle. I see the heel sucking under. It's a hind foot. I see the angle of the coronary band looking a little bit too steep. And so to me, those are all things that make me think about negative angles. And of course, I can pick up this foot, pick it out, and measure the depth at the back of the collateral groove versus the front to make sure I'm on the right track. This is where it's so important to do that and not just pick up the foot and trim it and think about that later. Because if I had trimmed the heels on this foot and the toe, I would have maintained the same negative angle. I would not have improved it. All right.
Interruption. How do you measure the coronary band angle?
Well, I don't really. I just kind of eyeball it. I used to have a 30-degree measuring angle, like a cutout piece of paper that was cut at 30 degrees. And I used to hold it onto the foot to see if the coronary band angle was sitting at 30 degrees. If you use any type of app that allows you to measure angles, you could do it with a picture after the fact. But typically, from a trim standpoint, I don't really measure the coronary band angle while I'm trimming. It's something I would look at in a picture later with other tools to measure it.
Okay.
Okay, so this is Bentley before and after a trim. She also wore composite shoes after this, but just another good example. So we'll go through her. I would envision her coffin bones sitting about here. I see a negative angle in the before. The toe is very long. It's not bull-nosed. This is a front hoof too, by the way. Typically the front hooves with negative angles don't have the bull nose. They have the ridiculous long forward toe and very long curving under run heels. And then we have our after trim. We'll look at that one again as well. And so still not great. I just want to point that out. We have a negative angle in the before, and we have a ground parallel coffin bone at rest after. To me, we didn't create enough of a change. So I actually put a wedge in her composite shoe to create a few degrees of that positive angle. Sometimes I will do that, and sometimes I will not. To me, whether or not I use a wedge doesn't necessarily depend on whether the coffin bone angle is positive or negative, but about how comfortable or uncomfortable the horse is higher up. If the horse is comfortable and functioning fairly well, even with a negative angle, then I will work on building positivity in the angle through my trimming over the next several trim cycles. But if the horse is uncomfortable and not coping well higher up in their body, that it's creating more of a systemic breakdown of the biomechanical function, then I'm going to start considering wedging. So I don't just always wedge because the coffin bone is at a negative angle. But sometimes I do. So that's not the greatest, when to do this and when not to. To me, it's based on the comfort of the horse. And so after the fact, we've been able to improve that. Is it 3 to 5 degrees? Probably not. It's probably more like 2 to 3 degrees, but it's better than it was. And we'll keep working towards making it even better. The one thing I will say, I don't love this package, this shoe with wedge combination, only because it's so thick on the bottom of the foot that it raises the whole front end of the horse up by half an inch, maybe 3/4 of an inch. What I have started doing now is actually grinding my shoes into the shape of a wedge. Now, admittedly, I am wearing out the shoes faster and they are not getting as many resets, but it's overall a much lighter, to me, less cumbersome package. I like it better. So I typically don't use the wedge in the shoe like this anymore, but both
Christy,
work.
Christy, in this hoof, you did not touch the heels at all. You just
No.
trimmed the okay.
The heels were way too low. And that means that I'm leaving them ugly. Like when you look at this barefoot trim from the bottom before I put the shoe on, the heels are folded over and ugly. But if I trim them, I'm going to lose another 1/4 of an inch of height in the back of the foot. And then I'm not even going to be able to fix it with a wedge. I'm going to need 3 or 4 wedges. So I would rather sacrifice and leave the ugly heel on the bottom to provide the lift to create balance in the bone, which will align the limb and help the discomfort higher up, and work to fix it over the next several trims so that eventually let me go to the next slide. When this heel wall is coming in more vertical and upright, then I will be able to start trimming that ugly folded over heel and help everything improve all at once. And I'm not saying I'm right and someone else is wrong at all. I don't mean this. But when I talk about, what I saw David Landerville doing at the clinic, is he would trim all that ugly heel off, even if it created a negative angle, because he wasn't concerned about the higher up biomechanical function of the horse. He was concerned about restoring function to the live structures at the back of the foot right now. And so that's really important too. I have to say that's a really hard line for me to walk. The longer I've been trimming and riding and training, the more concerned I am right now about the biomechanics of the horse, even if it means a little sacrifice to the health of the foot. I will build that hoof structure later. Um, and so I don't know if I'm right or wrong, or there is such a thing as right or wrong. I think there might just be a situational, idea that we have to be open to doing it either way depending on the horse. So for this particular horse, Bentley, she was very sore. and this resulted in her feeling better. So I had to look at it from the standpoint of her body, not just the foot. But if I had a horse where they weren't compromised in the body and it didn't really make a big difference higher up, then I could look at potentially leaving them in that negative angle a little bit longer while we improved the foot at the same time. I don't really know. I just think it's worth noting that I don't think there's a right and a wrong. I think it really depends, which is obviously what makes this job so darn hard to teach. All right, I want to look at Flash as well. This is a hind foot. He came to me with shoes on and I pulled them. This was his first setup trim. So I'm looking at this foot and I'm seeing a negative angle. That's the first thing I see. We've got a bull nose, we've got a very steep coronary band, and we've got this heel just growing way under, especially in relation to the dorsal hoof wall angle. And here's our after. Definitely improved, but we'll go through it a little bit here. So I look at this one and I've got more space in the front than I have in the back. And then we look at the after in just, I mean, he came to me with very long toes. He had so much toe under here. If I had a wider mouth on my nippers, I could have actually cut the shoe off without pulling the nails. He had that much excess toe, more so on his front feet, but he was very, very overdue when he first came here. So again, this was a case of just trimming down the front of the foot to decrease that vertical height so that we could realign the coffin bone so that it's not sitting at a negative angle. And he didn't go in composite shoes after this. I was able to gain, I would say, probably close to 7 or 8 degrees, to go from, -4 to 5 to +3 to 5. That's a pretty big change that we could achieve with just trimming alone.
Please don't
And
shoot me.
no,
So I never thought of it when I rasp, I only rasp the toe and I put a bevel on. Hopefully it's a 45. I'm actually lowering the front of the hoof.
absolutely. You are lowering the front of the coffin bone anytime you
Right.
trim the
But
toe.
yeah, and that did not sink in. I just, yeah, didn't sink in. So I just want to let you know that, you know, that's good to know that the bevel is to lower the toe so the coffin bone can be sitting lower.
Well, yes, it's for that, but it's also to remove leverage. It serves two purposes, right?
Right.
If we
The
just wanted
leverage.
to lower the front, and we didn't care about leverage and breakover, then we could rasp it flat. It doesn't have to be a bevel. In fact, it would be more effective if we rasped it flat because we could rasp into the sole and thin the sole, which we wouldn't want to do, but we could gain more degrees of angle by rasping it flat. Rasping it at a bevel leaves that toe callus proud, which if we don't invade the sole, leaves the toe sitting just a little higher than it would if we rasp that flat. But we do the bevel because we want to reduce leverage on the hoof wall and all the other things.
Okay, so it's twofold. Okay, got that. Thank you.
Yeah,
I'm
no
learning a
problem.
lot today.
Good. Well, this is the last picture in my slideshow anyway. Again, it's just looking at this bullnose hoof, the steeper angle of the coronary band, and that sucked under heel angle. And this heel angle does not match this dorsal wall angle. That's really, really common in NPA hooves. Whether they're front or back, it doesn't matter, but typically this on the front hoof, it's way more flared and forward as opposed to bullnose. All right. Hopefully that's helpful. I mean, I could have gone on and done 10 more hooves of the same thing, but I didn't feel like that was super productive. Really, what I wanted you guys to get out of this slideshow is, and Tina, you were very helpful actually, because you have all the right questions. I want people to understand that trimming the heel and trimming the toe, it's not as simple as make it short and make width equal length. It's also a matter of all of these angles and the things we're changing. Am I so specific that I measure all the angles? Absolutely not. I am not that specific. But am I thinking about positive or negative? Yes. Am I thinking about really positive or really negative? Yes. Like those are thoughts in my head. And when I'm dealing with a case where a horse is very sore or uncomfortable or lame, I'm going to be way more specific. Or a horse that for all intents and purposes, should be going fine, like my horse Tango. Okay. I hadn't really put much effort in to thinking about negative angles because to me they were borderline. But then I was having trouble engaging her hind end and really getting her to come under, in spite of thinking I was doing all the right training. So getting x-rays, I wanted to rule out everything I possibly could from a medical standpoint. Um, I actually really honestly thought we were going to find that her hocks, were very arthritic or her stifles were blown, or I thought we would find some big issue. And the only thing we found was she was -1 and -2 degrees in her hind feet. And then I went in and I added wedges. Excuse me, I built her custom wedges out of the shoe because I didn't want the thick package. And she was way more free in her movement and able to get that hind end under. And now this is not a forever plan. She wore those wedges, I think, for about 3 cycles. I just pulled them because now through trimming, I've been able to change the angle of the foot with the trim. So she no longer needs the wedge in the shoe to maintain that positive angle. But it took a little bit because I had to grow out more heel. And in order to grow heel on her, I actually had to cover it up with a shoe so it would stop wearing. Because the way she was coming in, that airplane coming in for landing, is very, very shallow for her. Being a gaited horse, they do not have a lot of elevation in the limb, in the stride. And so she keeps wearing those heels short. And so this is my experiment. It may well be that she needs to wear a composite shoe on the hinds forever, not a wedged one, but simply to prevent those heels from overwearing because of the way she moves. Or hopefully I can get her moving correctly so she stops wearing them off. But I don't know that yet. It's a bit of an experiment. I think the more free and the better I can get her coming under and moving, the less she's going to wear those off. But it really has to be a balancing act, and along with how her body is feeling and some of her other issues that she has and the training and the tension, and like it's all of the things, which is why I just can't peel it apart and be like, oh, it's a foot issue, add a wedge. It is a whole horse issue that has to do with everything from the way she grazes in the pasture to the way I work her on the line to the way I ride her and how I trim her and all of the things. It's all of them. So it's not simple, but it also doesn't have to be crazy complicated. We don't have to measure it to the nth degree. I only get that specific if I'm really struggling to find what's going on in the horse. All right. Anybody else have any questions? Or Tina, you have any more?
Yeah, but I'll wait for other people. I don't want to be the one that has so many questions.
That's okay. Nobody else is asking anything, so
Okay, I will ask away. I'm not shy. Um, well, maybe what I just realized is that okay, so my front hoof of my horses never look the same. They're always off. Either it's like when I look in them from the bottom, they look fine, but look from the front, they're like flared more in the quarters, then they're more some are more flared on the medial quarter, some more flared between like say 12 and 2. And so I have a hard time getting them equal. So now I'm have to think about getting the palmar ankle correct with a collateral groove and the back of the hoof and the front on where the frog is. That I have to add to it. Then I have to also consider that the hind ends, and I have a gaited, as you know, she's been wearing her hind heels out off much faster. So maybe it's a gaited thing. So now I have to consider what's the relationship between the NPA of the back and the NPA of the front. If I have the front is negative, like if it tips down further than the back, that's going to affect her biomechanics as well.
absolutely. And it is a gated thing. I mean, gated horses are smooth because they do not have loft. I mean, Icelandics are a little different. They have loft in the front end, but not as much in the hind. But it is also, it's not only a gated thing. Horses with restriction in the hind end that can't come up through the stride will also wear those heels. Horses who are ridden inverted and hollow do not have the muscular ability or the ability to push through and come through from the hind to give them the elevation in that stride. So they will wear their heels as well. So it's not only a gaited horse issue, but it happens to be common in gaited horses because they typically don't have as much loft. And knee action doesn't always equate to loft. I mean loft through the body. Like when you think of a dressage horse doing that big fluffy trot, the legs move, but also the body of the horse is moving through space up and down, whereas a gaited horse just stays flat regardless of what the legs are doing. It's the way they articulate them to change that.
Okay, I have a lot of homework to do.
But I will also say it doesn't necessarily have to be this complicated. Like when you said, oh my gosh, now I have to worry about the palmar angles and this. If you have a healthy connected hoof wall, okay, that's a big if. But if a horse has healthy connected lamina and good elevation of the coffin bone that equals concavity, then when we are trimming from the bottom, like we don't always have to measure the collateral groove depths because if you follow the sole in the healthy foot, if you trim the heels down to the sole level and the toe back to the edge of solar concavity, you will maintain a positive angle. You don't have to always break it down. When we have to start breaking it down, every single one of the horses in the slideshow, except for Tango, all had compromised hoof wall connection, less concavity than they should. That's when we have to start to be way more aware of the potential for negative angles. The sole grows from the bottom of the coffin bone and can be a very good guide if and when the coffin bone is in the correct position. So it doesn't always have to be complicated.
Right. It might not have to be complicated, but it's something I was not even aware of to possibility of the front, the back, lateral, medial. So all this together, it's because I thought, okay, I know how to trim the hoofs, but it's just not that easy or it's not that simple.
Yeah, and so would I like someone who's brand new to trimming that is just learning to trim, I would tell them to not watch this slideshow, right? Because it makes you think about like, oh my gosh, this is actually really complex and hard. But yes and no. You know, you got to start somewhere. We start with basic trimming and we evolve. That's why you're here now, continuing your learning. Now you add this to your toolbox and you start thinking about those angles. Um, and then we'll learn something else.
Okay. One more question. So
Okay.
when I look at the bottom of my pony's feet, I know they're all ponies. The outer pigmented wall is good. The next one, the unpigmented, what looks white,
Mhm.
is good. And then the golden line seems to have tentacles. It seems to be wider. It's not as compact, especially around the quarters. And it starts getting full with dirt. So that is a big concern. And I assume it's from the flares, the quarter flares.
Mhm.
So unless I get the quarter flares under control, I'm not going to be able to fix I call it a lamella wedge, but it's not a lamella, but it's the white line.
Absolutely right. I wouldn't call it a lamellar wedge, which is silly because it is. Any stretched white line is a lamellar wedge, but typically I would call it stretched white line. And you're right. It is likely a result of flare in the quarters, which are likely a result of you not trimming enough quarter arch in. Quarters tend to flare when they don't have enough arch from the bottom. And then it starts to pull away and stretch that white line. That's also, or golden line, sorry. That's also where people start to see the dirt going in there and they get separation. And then people panic and go, oh my gosh, now I have white line disease. Um, yeah, okay, probably, but it's not really white line disease. It's a symptom that goes all the way back. All of those things are a symptom, probably of not enough quarter relief and or not enough removal of the flare.
Okay. If the white line only goes around the soul, how can that actually be okay, so it can go into lump and then okay, I got it. I just had to think out loud. Okay, sorry, I'm done.
No problem. Sheena, did you have a question?
I do. I was curious your thoughts on um, kind of what comes first, whether it's poor trimming that causes the angle or biomechanics. I'm sure it's a depends answer, but I still want to hear your thoughts about that. I have a few horses, I mean, most of my horses have negative NPA on the hinds, but I have some older horses that have had poor trimming their whole life. And I'm just kind of, they also have some body issues. And so I'm just has made me think about kind of which causes which, or I mean, it could be either. I also have a question about one of my horses when he was younger. He used to twist the back shoes on his feet, and I'm just curious your thoughts on what would cause that.
Okay, so the first question, I have to say honestly, I don't think it's as much trimming error as I would like to. Um, because most farriers under trim, not over trim. So it's probably less of a farrier trim issue, so to speak. I would say too, a huge majority of horses don't move well. Like we train them to tolerate being ridden. We don't train them to engage their core and carry us appropriately as they would if they were not carrying weight. But it's also not just that. There are some people who train horses very well to be ridden and can engage that hind end. It can also be dysfunction. You know, any horse that has a restriction of mobility through the hock, stifles, pelvis, SI, lumbar region is going to suffer from a lack of elevation in the articulation of that hind limb through the stride. And your airplane is going to drag on the ground before it lifts up again, you know, like it's too heavy. And that is definitely going to contribute to the NPA more so than a trimming issue. Because if it were only a trimming issue, at the end of your 4 to 6 to 8 week cycle, it should be remedied with the heel growing. I mean, other than the toe grows at the same time, but it doesn't really work like that. I mean, it can, absolutely can, but I think it's more restriction through the body. That would be my gut answer. And if we can, so it becomes really chicken and egg too to how do we get out of it? Because like in a perfect world, let's just like snap, 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 chiropractic adjustment, horse is great. Like it never works like that. Never ever does it work like that. But let's say it did. Some problem solved. Off you go. It's not going to work like that. And so we need to adjust the feet usually to create the change the body needs for the body to start coming online too. And so that's where I would go to probably a wedge shaped shoe to provide that instant support so that then I can start picking apart the body of the horse and unraveling things. Because it doesn't matter if the horse had pelvic dysfunction and that's what caused it. Now the horse has negative angles and everything is overstrained and probably suffering as a result of the negative angle. All the things that weren't contributing to the pelvic dysfunction in the first place. And so until we change that, we can't begin to undo the initial cause. And that's when I would go to the wedge or something like that. And horses in those cases that have some type of physical thing, until you can remedy that, which we all know doesn't always happen ever, like Tango, she might always need those wedges on the hind if I want to ride her in such a way that I can fully engage that hind end. Now, if I just want to trail ride and do lighter things, I probably don't need that, depending on the comfort in her body. So you have to weigh that out for those cases. The twist in the hind leg um, can be the same and different. Like Tango also is super twisted in her hind end. When you watch that horse trot from the back, her hocks like wing out to the side, but her leg, like the hoof itself, takes off and lands totally straight. But those hocks are just going all the time for her. And I'll never change that. That is the way she's built and the way she moves. But I have also seen horses really tight in the groin or misaligned in their pelvis. I've seen them have a twist that gets better over time as the body issues improve. I have also seen horses with a lot of twist that tend to be conformationally either turned in or turned out. If they're turned in, usually the medial heels are a little bit high, which that is also a chicken and the egg. They're turned in and the heels grow high. But if we never even those heels, the heels just get higher and higher, and then the hocks come in further and further. So typically, even a conformationally, I want to say defective, my horse is defective, a conformationally defective horse, I will still try to achieve a little bit of balance in the feet to keep that twist from becoming worse. Versus if you never try to balance it, it's usually going to get progressively worse. So it's kind of, again, just unraveling what might be a symptom or what might be a root cause.
Gotcha. Thank you.
Yeah, no worries. All right. Anything else before we sign off? And I gotta go to work. I got horses trailering in for trims. So not yet, I mean, but in general, that's what my afternoon looks like. Busy, busy. All right. Well, then I'm gonna wrap this up and get it posted and go do something fun before I have to work. But I appreciate you guys hanging out with me and Tina asking all your questions. I mean that. It's awesome because if you have those questions, other people have those questions. And when nobody shows up and nobody has questions, these are really short Zooms. So it's great.
Thanks for the feedback. I don't want to cause problems, but if I have a question, yes, I will definitely ask. Thank you. Awesome Zoom. Appreciate it.
Yeah, no problem. And Dave, thank you. It was great to see you here. Awesome,
Bye,
awesome.
everybody.
Have a great day.
Bye.